हमारे पास लिंक है ना, ज्वाइन करने।
Great. We are live, and we're going to go live now. Thank you very much, everyone, for joining. I'm going to give maybe 15 more seconds for people to log on, and then probably start with some housekeeping and then dive in with the conversation that we have today. Okay, super. Hello and a very warm welcome everyone to my conversation series where during the lockdown I have brought you specialist speakers every other month on different topics which impact our daily lives and more importantly our loved ones. My name is Rabindra Jhunjhunwala and I'm located out of Mumbai. Today's awareness session and the sharing session, we have once again Dr. Santosh Agrawal, a leading pediatrician logging in from Kolkata. Dr. Agrawal is a senior consultant pediatrician and neonatologist. He is also the advisor for postgraduate doctors undertaking London's Royal College of Pediatric and Child Health Examinations in India. He's also representing them as an examiner for the MRCPCH and the DCH exams for them. Thank you very much, Dr. Agrawal, for sparing the time for us today.
Thank you. Good afternoon, friends and parents. And a big thank you to Rabindra, to you, to organize this webinar, to give some insights about COVID in children, which is a burning topic today.
Thank you very much. I would also like to add that these conversations have been hosted actually for a year now. And as it so happens, yesterday was the first anniversary of the lockdown conversation. And you may or may not remember, but it was Dr. Santosh Agrawal who was the first speaker in the lockdown conversation. So, what an ideal way to celebrate the 1-year anniversary of lockdown conversation. So thank you, Dr. Agrawal. A big shout out to all the other speakers who have shared on this platform, doctors, friends, psychiatrists, those who have gone through things, educationists, ENT, several others who have brought in their knowledge and shared. For this session, I would like to acknowledge and a big shout out to my friends Pooja Barwani and Sandeep Shah, both of whom I would say have egged me on to do this session on children. Pooja shared some reports on the MISC, and we will discuss this in a bit of detail. And I got concerned about the syndrome and about what we could possibly be we would possibly be encountering in the future. And I thought, why not we pick this up? To give you context, I have 2 kids. There are 5 others in the family, and it is important to discuss COVID and its impact on children. I'll pause there for a moment and as always, get a poll going just to get context on the participants today. So Samuel, if you can help me with the first poll. So since it's being streamed live on Facebook and the questions will not pop up there, the first question is, what's the age group of children? So those of you who are logged in, and that's a very high number of people who have logged in, if you could spare a moment and respond to the question. Once again, what's the age group of the children? And there are 2 options, birth to 1 year and 2 years to 18 years. Dr. Agrawal, the relevance for segregating and asking the question to the attendees today.
Thank you. So far, we have been hearing and seeing COVID infection in adults, very little in children. Not that it's not happening, but not to the extent that we are likely to encounter in the future and in the middle term, probably we could say. Children who are less than 1 year can suffer very seriously from COVID infections, and children between a year and 19 years, 18 years, I would say, could have other representations and presentations of COVID, which may be different from adults.
Just so that you know, I'm going to end the polling now, and I will share the results. This will be viewed by those of you on Zoom. It won't be there on FB, where we are streaming live. A very, very high percentage, obviously, of children, doctor, who are in the age group of 22 to 18, more than 90% in that age group, and the rest who are in the age group of up to 1 year. So I'm going to take this off and sort of dive right into the topic that we have today. And again, maybe to set the context, the timing of this seems to be very appropriate. There's been a very high level of interest. I must say, the WhatsApp group literally filled up in 20 minutes. We had to create another WhatsApp group. We had to roll out a link. We have, I think, more than 250 people logged in at this point of time. Never had these many registrations from friends and family. We've had people who've passed it on, thank you very much. And we've had over 300 questions which have come in before we went live. What we have done between the speaker and myself, we have grouped these questions and we bucketed them into 6 odd categories. So we will start with the introduction. We'll talk about symptoms. We'll then go across to treatment. Then a lot of questions on immunity. So we'll discuss immunity. We will discuss post-COVID and cover MISC, which is something which all of us should know. Spend some time on vaccines, and then dive into specific questions and answers. We'll see how much time we have left, but we will try and get all of this covered in the hour and 15 minutes odd that we have. So once again, Dr. Agrawal, thank you so much.
Thank you.
What we have seen is COVIDs in children are increasing. There are lots of positive cases amongst friends, amongst family, amongst our contacts. And from what I understand, they're not just carriers and infectors, they're also getting infected. Many of them are carrying symptomatic symptoms. What I also understand is that they're responding to regular medicines and they're recovering well. So, Doctor, first question, and maybe a general introduction from your side on COVID, its impact on children, what was the reason? So general initial thoughts, please.
Yes, thank you. So these are probably the most difficult times mankind is facing. Every household has a story and a challenge to our physical and our mental resilience. Why did we have a second wave of COVID? Were we complacent on less COVID appropriate behavior in us? Did we think that this was the end game of COVID in our country? Or was it the highly transmissible mutated strain that came in and we were caught off guards? The vaccination process in our country had started in good earnest early part of this year. And I think we were doing quite well. And we had a nadir of the curve when the cases went down to 8,000 or 9,000 sometime in February this year. But different variants like the UK 617, the South African strain, the Brazilian strain came into India initially in a scattered way, which did not have much of an effect. But once these strains became concentrated and it gained momentum, it was virtually impossible to contain it. So COVID being a viral illness, as we all know, it never goes away. All viral illnesses, apart from COVID, things like measles and polio, they don't disappear. They come in waves, and so did COVID. But the mutated virus with the variants of concern has been the primary cause of this upheaval. This is massive, ferocious, where the healthcare system could not bear it all. And what happened last year was perhaps a trailer of what's happening now and what's in the store for us. Talking about the third wave, yet we would say that it's a possibility, but as of now, these are assumptions. The government of India's scientific advisor has put on some thoughts that it's a possibility there. But unlike last year, when we had adults suffering, this year, we've got children suffering as well. Not that children did not suffer last time, but there are a lot more. The reason could perhaps be because more than a few members in the family are suffering. Sometimes the whole family is suffering. So naturally, the children do not escape the infection. But the good thing is that children, by and large, have a milder infection and they get better. So it's very important for us parents and some grandparents who are attending that we know the exact course of the COVID illness when it does come to our family, when it's knocking at our door, and how to really take it hands-on.
So a lot of questions that we have got, and you and I have categorized it in that first bucket of prevention and protection and general safeguards that we need to take. We have also had a number of parents who have mentioned how it's difficult when it comes to young kids to maintain the guidelines which are prescribed. So perhaps maybe if I can take a few questions from that bucket, or maybe if you want to have some general thoughts first, and then we can take some questions.
No, it's perfectly all right to take those questions.
So question really, sir, is in terms of prevention and protection, what is it that we can do as parents for our kids or grandparents or uncles and aunts for the children in the family? What safeguards should we take? And if we can talk a little bit about how this virus is different vis-a-vis the children.
Yes. So this virus, as I said, because it has mutated, which is a natural character of viruses, the virus tends to change its character. Sometimes it just gets wiped out. Sometimes it becomes stronger. It drifts and it swifts. And in that process, it changes its character. So the virus has mutated in such a way that it's taken a massive toll onto the entire population of the country. And this time, because more and more adults are affected, even children are being affected in a big way. As far as prevention is concerned, what you said, I think we are looking very strongly and hopefully at the trial that's going on with our Hyderabad-based company that makes Covaxin. They have been given the permission by the Indian Council of Medical Research, ICMR, to do the second and the third phase trial on Covaxin for children from 2 years onwards, which no other country at the moment has done. The latest in vaccination has been Canada and the US, which have given permission for the Pfizer vaccine, which is the mRNA vaccine, to be used in children between 12 and 15 years, or 12 and 18 years, I would say. It's needless to say that our children need to follow the same protocols as we have been following of hand washing, mask where appropriate, hygiene, and social distancing. They remain of utmost importance to them as well. And when they see we parents doing it, they have to follow the same lines. And now and then we should keep reminding them so that that is the only way of keeping COVID out till the vaccination comes in.
So what we understand is that children are getting it. It's mild. They're recovering. They are not only carriers, but they're getting infected. What they should be doing is very much same to what adults are doing. What is different is probably we haven't seen as much severity of the disease in children. One specific question, if I may ask, how to take care of children if a family member is positive, and a number of attendees have asked this question.
Yes. So if supposing one of the parents or both the parents are positive and the child has got no symptoms, the child needs to be looked after by one of the parents. So if we have no other alternative, but one of the parents who are positive has to look after, then I think the parents have to wear a mask. They have to wash their hands frequently and look after the child depending on the age of the child. I mean, it's very difficult for even a 10-year-old to look after himself or herself. So one of the parents have to be involved. Whereas if the child is positive, has tested positive, and the parents are negative, it may be a difficult situation for the parents. So the first thing that parents should not do is in any situation send the child to the grandparents or involve the grandparents, because they are more likely to be affected. So in a situation where both parents are negative, but the child has tested positive, one of the parents has to look after the child. If both parents and the child are positive, then there is no point in isolation. They can all remain together. And if it's an infant at home, a little baby, the baby can be breastfed. Mother has to maintain hand washing and wearing a mask in case it's a different strain of the virus that's affected the mother and the baby. We have to take that into consideration.
So a lot of questions are actually coming in as I read my screen. And just to let you attendees know, we are going to cover vaccines. The doctor has mentioned about Covaxin and its coverage on children. We are going to have a separate section and talk about it. We are also going to take some more, some questions which you are asking, also about what supplements, etc., to be taken. So please bear with me. I just wanted to ask one question, considering we need to move on to the next one. Just one very quick one is a lot of parents are finding it very difficult to maintain the COVID guidelines or the ACT behavior for younger children. So I know it's very difficult, and in this lockdown and in the circumstances that we are in, it troubles them as well. So how do you handle kids like who are 2 years or 3 years and under? They are not going to wear masks. So any sort of thoughts there for our parents, young parents?
Generally, masks are recommended for children much over 2 years. But I think it depends on the individual child and the set of parents, how they manage. I've seen even 10-month-old babies having a wonderful mask-like stuff on their face when they come to the clinic. Once or twice I've seen. And the child is very happy, smiling, and so are the parents. On the other hand, even a 5-year-old may find it very difficult, and any child wearing a mask has to be monitored by the parents, because the child may feel suffocated inside the mask, and we parents have to be very aware about it. As far as hand washing is concerned, that's something that we can always take the child onto a course where we show them how to wash. We wash ourselves for the 20 seconds or 30 seconds, and the child has to follow it. So it's reasonably easy to show them that. Social distancing, again, may be very difficult with children, because children are missing on their school at the moment. They are missing meeting their friends. They are missing the ice cream that they would normally have when they go out. So naturally, these things are going to lead to some sort of anxiety, mental issues in children. So it's very difficult to follow the COVID appropriate behavior with children, but we must try our best, because till we have the vaccine, that's the only way out.
Thank you. I'm going to run another poll, and we want some responses from the attendees. So Samuel, if you can put up the second poll question. And for the benefit of those who can't see it on their screen, especially those who are logging on live on Facebook, has a child in your family tested positive? So it's just a yes or no response. If you can quickly take time out, and please don't respond on the chat. Kindly click the poll, because that's we want to project the results as well. So has a child tested positive? And while that poll is on, perhaps maybe just to brief everyone, and Doctor, the next section, if we can talk a little bit about signs and symptoms, because there's been a lot of questions and queries around this. I'll give 30 more seconds for people to respond to the poll. The question is, has a child tested COVID positive? Yes or no answer. I'm going to end the poll in just a bit. A lot of questions coming in on the chat. And yes, we are going to cover about medication, symptoms, asthma against COVID, and all of that. So bear with us. I'm going to end the poll and share the results. A very high percentage, 84%, who haven't had. So what is critical and what is important for this 84% is to know the symptoms and track it. And those of you who've had it, a smaller percentage, we will sort of come back to what you need to do post-COVID just after this. So Dr. Agrawal, a very high percentage, 84, who've not had COVID, which means the next section is so important for them. They need to keep a track. They need to be mindful of the signs and symptoms. So, sir, what would you what symptoms would you classify as something they need to be worried about? And especially this change of season, at least in Mumbai, we are expecting rains this weekend. So some thoughts on that, please.
Yeah, thank you. So before coming on to the serious symptoms, I think we should start with how to suspect COVID in a child. What are the initial symptoms that a child could encounter? And the parents need to be very careful. Any fever in a child during this pandemic has to be thought about as COVID first and not anything else. So fever of whatever range is one, and then a cold, cough, runny nose, which is called coryza, body ache. Children can have just diarrhea, vomiting, and pain in the tummy, and no fever at all, and still it could be COVID. So all these are symptoms of COVID, and one has to take into account whether the child needs to be tested or not. So once the child has these symptoms of fever, cold, cough, runny nose, body ache, diarrhea, vomiting, pain in the tummy, I think the time is right for them to have an RT-PCR. If a child has just been in contact with parents or somebody else in the family who has tested positive, then we can wait till the child becomes symptomatic. Or if we feel a close household contact has had it, then we can go for an RT-PCR early on. So if we see when to test these children, first would be if the child is symptomatic. As we said, if there is fever to any extent, then we should check them, or they have cough and cold, diarrhea, or vomiting. And if the fever goes beyond 3 days, definitely they need to be tested. And as we said, if any family members have tested positive, we need to do a COVID test. And the gold standard COVID test would be RT-PCR and not the home test, the rapid antigen test that we do. That's not very reliable. If it is positive, it's fine, but we may land up in a false sense of security. Sometimes we do what's called a nucleic acid amplification test. It's called NAT. The advantage of it is we get the results in half an hour, but it may not be as reliable as the RT-PCR. But here, if I can just say one line, please, please don't consider any other tests for the child, including a CT scan of the chest, because these are highly dangerous thoughts. Because an adult has had these symptoms and an RT-PCR, and the next thing that the adult has was a chest CT scan. These are not the procedures to be followed in children, in our children.
So very clearly, the procedures in adults and children differ, and that is something which one needs to be mindful about. One question which I wanted to ask, and Deepak Jain has asked, especially with the change of season that we are going to encounter now, how do you identify between a normal cough and cold or a viral and COVID? Is there any way to do it?
Absolutely none. So during this pandemic, any cold, cough, or even the slightest fever that a mother or dad feels that it is the normal cold, no. During this pandemic, we cannot let it be accepted as a normal cold. We have to say that it is COVID unless proven otherwise.
And one more question from a lot of young mothers. After how many days should they do the gold standard RT-PCR test?
5 days if they are asymptomatic, and at the beginning of the symptoms if they have symptoms.
Great. I'm going to ask one last question in this segment, and from a very dear friend of ours, Dr. Sapna Sinha. Are there any predisposing factors or conditions that decide the course of the illness in children?
Yes. Once a child has chronic conditions, which we say comorbidities, I think most of us are familiar with this word comorbidities, which means a heart disease. Children generally have a congenital heart disease or an acquired heart disease, a liver disease, a disease of the lungs, any of those conditions, including, it will be shocking to some, obesity is encountered or is regarded as a comorbidity for children's COVID behavior. So we should be very careful with our children who are obese to take extra care there.
Thank you very much. We're going to move to the next section, and I know the chat is buzzing with a lot of questions. We'll see what we can cover. We have only limited amount of time. But Samuel, if we can put up the slide, and we are now going to move to the section of treatment. A lot of questions on what to do in terms of treatment, what to do in terms of building immunity, and a lot of questions with respect to supplements. So, Doctor, maybe your thoughts on the slide that we have shared.
Yeah, if I may just go a step further and say that asymptomatic children have no signs of infection. And COVID-19, majority children, maybe 85%, could be asymptomatic, but they can transfer it to others. Most of the diseases in children, to the extent of 85%, are mild disease, easily manageable at home. But we must know which are the signs that could change from mild to moderate and further to severe. So for the mild disease, the symptoms would be fever, which is treated with paracetamol. Every household has this, and most mothers know the dose as well. It can be repeated in 4 to 6 hours. I think we should avoid ibuprofen, mefenamic acid, although some researchers and some people would go on to use mefenamic acid, not so much ibuprofen, since there is no evidence against these as of now. But personally, I would say paracetamol and only paracetamol is the best. There is not much role of a cough suppressant. Throat needs some soothing effects, so warm saline gargles, and older children can even take steam. That helps a lot. Honey is used for older children, not for infants. They may get diarrhea. And let me very clearly say here that there is no role of antibiotics unless we identify that there is an infection which needs to be treated. And COVID is a viral infection, and there is no role of an antibiotic in viral infections. So basically, the treatment of mild disease is paracetamol and only paracetamol. But along with this, I would say the child should have good nutrition, a balanced diet, lots of fluids, which is very important for him to cope up with this mild disease.
So, doctor, when you say good diet, balanced diet, I think a lot of mothers are struggling, fathers too, what do you consider as balanced and a good diet? I have questions like whether milk is the right thing, what portion. We are so used to having junk food. So some thoughts on balanced diet and what's right.
Well, I think it should be a balance between, most of us know protein, carbohydrate, and fats, vitamins, and minerals. So I think this could be a good opportunity if we have been having lots of junk food at home as a family meal. We could reduce on those, a good learning curve for children as well. And junk food should be avoided. It should be comprised of fruits, vegetables, milk. Eggs contain a lot of protein as well as zinc. So zinc has been thought in moderation to be effective in COVID. That's why it's been prescribed on adult prescriptions. In children, we give it in a limited way. Vitamin C can also be derived from natural food sources like lime, lemons, citrus fruits. And so can vitamin D be, especially when we are indoors at the moment, from natural sunlight, if it is possible. Milk, cheese, and dairy products are also natural and good sources of vitamin D. However, some children who are deficient should be given vitamin D. We'll come to that later.
Maybe we can talk a little bit about immunity boosters and vitamin at this point of time, because I see there are a fair number of questions on the personal chat on that, right. And there are about 20 questions that I have, which is asking about various different kinds of vitamin supplement and specific food item. So perhaps maybe it's a good time to share.
I think many parents will be very upset when they hear that there is absolutely no role of any vitamin whatsoever in COVID. So in COVID, we should have a balanced diet. And the three things that are normally incorporated by some pediatricians, some physicians, is vitamin C, vitamin D, and zinc. Well, if I may say, vitamin D, if somebody is having deficiency, it's okay to take. But if somebody is fully saturated with vitamin D, it can cause toxicity in the body in the way of affecting the kidney and stones in the kidney as well. Zinc, again, if taken in excess, could harm the body. Vitamin C is a very soluble vitamin. Even if taken in excess, it's passed out via the urine. So we need to be very careful when we prescribe vitamin D, especially because it should be given in what's called maintenance doses, which is 600, 800 international units a day, not the 60,000, which is the therapeutic dose for those who are deficient. Sometimes physicians prescribe the 60,000 dose to be taken once a week, and we make a mistake and is given every day. And the 60,000 should only be used for deficient children, not for the normal child. For the normal child, the maintenance is 600 to 800 international units. So I'm very clear on these vitamins that one should not just carry on giving it month after month. And there's no point in checking it at this time because a child needs a blood test to be checked, which is not important. We can go by the prior records before the pandemic. How was the vitamin D status? If need be, we can give a maintenance dose. The zinc can be given for 4 to 6 weeks at a stretch. There should be a gap then. Vitamin C is all right to take from natural sources as well as in addition to the normal food.
And would this differ from for kids who are for babies for the category 0 to 1? Because we have about 10% people in that category.
Yeah, so 0 to 1, most of the babies would be breastfeeding at least up to 6 months, many of them beyond 1 year. So breast milk is very good in all the nutrients and the components that are required. Apart from some others, it may be a surprise to them. The only thing it's deficient in is iron. So after 6 months, one must ensure that the baby gets food which is rich in iron because breast milk is deficient in it. Otherwise, breast milk is a complete food.
So there are a lot of very specific questions coming in on the chat, and I'll have to apologize to the attendees that we may not be able to take such specific questions. I'm sure you have your pediatrician who you can reach out to, and they are available for online consultations. So you should definitely reach out to them for very specific questions with respect to the kids, with your kids. Doctor, maybe if I can ask you one more question, actually two questions in this category. I know of another dear friend, a school parent whose household, just about everybody, all the adults were infected with COVID. And though the children did not test positive, they did show symptoms. And post-recovery, they have sort of tested them for antibodies. And 2 out of the 3 kids have shown some levels of antibodies in them. So your thoughts, because I know about your about what you think of antibody tests. Maybe for the viewers, for the attendees today, should we do antibody tests? Is that relevant? Should we repeat it from time to time, etc.?
So these antibody tests that are available in the normal laboratory are not very useful at all, and we should not go for them. A natural infection that you are talking about, the parents had it, so they would have antibodies. Now the children, whether their RT-PCR was positive, if it was positive, they would definitely have antibodies, and those antibodies of an infection would protect the parents as well as the child for nearly, it's been seen, about 8 months or so, which is slightly more than the protection from a vaccine. The vaccine, that 8 months could be 9 months as well. Only time will show up. There's a lot of work going on this particular aspect. The vaccines probably have a protection of maybe 6 to 7 months, the messenger RNA, the Pfizer vaccine and the Moderna. And our Serum Institute AstraZeneca vaccine may be slightly behind at 6 months, 6.5 months protection. But these are all figures that need to be further looked into, and there's a lot of work going on this.
A question on immunity. If someone were to test positive, and let's specifically address this vis-a-vis children, how long do you think the immunity could last?
Sorry, repeat the question again.
I wanted to ask about immunity for a child who has been, who has gone through COVID, has been COVID positive. Are there some data available? Is there some data available, and any sense on how long the immunity could last?
Yes, the immunity from natural infection, obviously this child has had a natural infection, would be 8 months, as I said. 8 months is the period that they would be immune. And a chance of a reinfection during these 8 months are very remote, but it is there theoretically. And after 8 months, what would happen to the immunity, whether it was wane off gradually, or there would be a vaccine coming in between, which would boost the immunity? That's the model that we are looking at.
Okay, thank you very much. I'm going to go to the next section. I'm mindful of time, and we are really going to discuss post-COVID. And we're going to separate that into 2 smaller buckets. One is general category, and the other is MISC. Want to discuss and talk a little bit about MISC. So if we can start with MISC, and if we can have the slide up. Doctor, your thoughts on what MISC is, generally to educate a lot of parents, some who have asked and others who need to know. There are many people. Please, MISC.
Yeah, MISC is a multi-inflammatory syndrome that occurs in a child post-viral, post-COVID. It's a syndrome which has been seen from the age of 5 to 14 years. And the first case really was in the month of April 2020, last year. And it was in London in the UK. And the Royal College picked up that case. And soon there was word around. And lo and behold, we got a couple of cases in New York, and in India, in the month of May and June last year, we had good few cases here in Calcutta as well. If I can give you a figure of MISC that has occurred in children, up till yesterday, it's to the tune of 150. Children have suffered from MISC. So what is MISC? It's a post-viral syndrome, which is an overreaction of the body's immune system to the virus COVID-19. That means they were exposed to the virus with COVID-19 maybe a few weeks before, and they tested positive at that time. They developed antibodies, and several weeks or a month after the COVID, they developed the symptom of MISC, which presents as a prolonged and a persistent, unremitting fever, lethargy. The child develops some rashes on the skin, especially on the palms and soles and at the nail beds. The eyes may be red, not just a discharge from the eye, really red eyes. The mouth and the tongue can have a rash, which is red. There may be difficulty in feeding. There may be diarrhea, vomiting, pain in the tummy. An important thing to see is that they start breathing very fast. In other words, their respiratory rate increases, and so does their heart rate increase. So, and ultimately, this can lead to irritability and a bit of confusion. So neurological involvement is there. So if you see on the slide what's written, definition of MISC, 0 to 19-year-old with fever more than 3 days, and any two of the following. So 2 of the following out of these 5 are rash or non-purulent conjunctivitis, means redness of the eyes, or mucocutaneous inflammation of the hands, as I showed you, or the feet, and around the mouth. Hypotension is something that can only be picked up if the blood pressure is taken in an older child. And features of myocardial dysfunction would be when we notice that there is tachycardia. Tachycardia means a high pulse rate. It indicates that maybe something going on in the heart, what we call myocarditis, and an evidence of clotting disorder, and GI symptoms, gastrointestinal symptoms like diarrhea, vomiting. So any 2 of these, along with fever, are good enough to make we clinicians think that it could be that we could be heading for MISC in this child, which is not a very good omen. And when we do laboratory markers, bloods, we find that there is an elevated ESR, CRP, and something called procalcitonin, which is again an inflammatory markers. And we don't find any other signs of an infection apart from the hyper immune response to the COVID virus. And obviously, in the beginning, the child has tested positive for COVID-19. So we get a positive RT-PCR. So I think Ravindra had forwarded some of 2 or 3 families where they had gone through this, and their clinician on telecommunication could pick up that we are heading for this, and they were adequately and appropriately directed towards hospitals, intensive care, and both the children made good recovery. So the importance here is of parents to understand that when is my child drifting from the mild symptoms to the moderate and the severe symptoms. So if I may say, high fever beyond 4 to 5 days, decreased oral intake, that means the child is not taking and the child has become lethargic, increased respiratory rate. So there is a fixed pattern for, say, children who are from birth to 6 months, they breathe up to 40 times a minute. We breathe only 16 to 18 times in a minute as adults. So different age group have different normal respiratory rates. Anything more than that, and an increase of the pulse rate, which is tachycardia, and the oxygen saturations going below 94, 95, and a child appearing ill, a child who doesn't look good. These are the points that we should look at to consider. And unless our mind thinks and our physician, our clinician thinks about the condition, we are not going to pick it up. So the responsibility of we parents are to look into this rash that I described, the eyes and the mouth, the hands, the nails, and the hypotension could be only in an older child if we are able to check the blood pressure. But if we are able to use a pulse oximeter, we can get the heart rate there if it is very high. And then diarrhea and vomiting and pain in the tummy are very important. And then we do the laboratory markers.
So this is obviously a critical concern post-COVID, something which parents need to keep in mind and reach out to their pediatrician. If I may ask you some more general questions on the post-COVID segment, number of parents who have reached out and asked about dietary, what should be done with respect to diet, what should be sort of the activity of the children. And again, the same question around supplement and what the kids should be given. So if we can address that, and then maybe a few more follow-up questions.
Sure. So again, we come back to our same balanced diet, which comprises of the household food that goes on with a stress on the protein. Post-COVID, when a child is recovering, the requirement of protein significantly goes up. So one may ask, where do we get the protein from? It depends on what is cooked in the kitchen. You know, peas, beans, pulses, they contain a lot of protein. The egg white contains a lot of protein. Rajma contains a lot of protein. Again, chicken, lean meat contains a lot of protein. So protein should be incorporated. Fruits, vegetables, lots of fluids is very important that the child takes. And during this period, it may be a good idea to supplement with vitamin C, vitamin D, and zinc, not for long, but a maintenance dose for maybe about 3 to 4 weeks.
And what about follow-ups? Is that comparable to adults in the case of COVID vis-a-vis children?
Yes, ideally an adult is followed up to 3 months, 12 weeks, really, for his post-COVID symptoms. Sometimes they have what's called long COVID. So on children, we do not have much data, but I would say we should definitely follow them up, you know, without making them anxious if they are older children. But as parents, we should be in the lookout for these signs that we have said in case they appear, or the child appears unduly tired, lethargic, and not taking much interest. These are signs that we should perhaps have a consultation with our physician.
And I know a number of people are sending personal requests for online consultation. I'm guessing that you're also available for online consultation if somebody wants to ask something very specific, because it's not possible to take all of the questions which are coming in.
Yes, we do online consultation, but I would have one point here to make, that anybody living in Mumbai or Delhi or Bangalore should have a local pediatrician just in the event that we were to move from mild to moderate to severe illness. That pediatrician would be able to arrange a hospital bed or a pediatric intensive care setup. That's very important. But yes, online consultations are the way out, because even if one were to see face-to-face in the clinic, I think the physician would not come very close to the patient if it's a suspected COVID, rightly enough. And it's not necessary, really. And if it is necessary, then the child should be in the hospital with moderate COVID for observation, not in the intensive care. And if situation worsens, then of course the intensive care. So I would say moderate to severe. You know, if we are very careful, the moderate ones can be observed at home with all precautions, but we should have a easy way to get into a hospital with the moderate cases, so that we can know when our child may be drifting towards severe illness.
Well, hopefully with all the knowledge that we are sharing and with the guidance that you are giving, we'll be able to reduce the number of cases. I'm going to quickly move across to vaccine, and a number of people have asked questions around vaccine and specific to children. I know you touched upon it earlier, mentioning about Covaxin and the developments, but maybe a general update at this point of time with respect to what is happening with respect to vaccine vis-a-vis children. What is the update, potential third wave, how to protect children today who don't have a vaccine? If it comes, should they take it? Some general thoughts.
So as of today, I think our vaccines in India that are available are only for 18 years and above. We are presuming that we will have the Covaxin, which is under trial for children. And the only way to face, if there is a third wave, is really a vaccine, because the vaccines have certainly proved that they are very effective in spite of some of them having side effects. The side effects are negligible in comparison to the morbidity and mortality that is associated with the disease itself. So we need to ignore these vaccine side effects, ill effects, yet we need to keep an eye on them and be monitored very properly. Like if somebody has got an allergy to a particular substance, whether one should take that vaccine or the other vaccine, things like that, they should be assessed. But as far as children are concerned, as of today, we do not have any vaccines for them up to 18 years. But I understand that the Moderna and the mRNA, the other vaccine of Pfizer, is likely to come to India. We don't know when. And that could be a good support for our children between 12 and 18, because they could avail that vaccine as and when it's available.
So the obvious question with respect to this is, the vaccine is available for me. I'm a lactating mother. Should I be taking the vaccine?
Yes. Up till a few weeks ago, the answer to that was don't know. But now we are clear that a lactating mother can take a vaccine. It's good for her, and it could prove good for her baby, who could get antibodies passing through breast milk. So the answer is a big yes.
And the same question, since some people have asked, and I have it on my sheets as well, should somebody who's pregnant go ahead with the vaccination? Any thoughts there? Again,
till a few weeks ago, the answer to that was not sure, or we should wait and watch. But now there are guidelines that say that a pregnant mother could take vaccine at any stage of pregnancy. Although personally, I would say, if it were possible, it should be taken in the third trimester, because in the first trimester of pregnancy, there is organogenesis going on, which is the organs of the baby being formed. And in the last trimester, if we take, the antibodies are highest during the time that she's going to deliver. So the peri-delivery period, which is called the perinatal period, at the time that the delivery occurs, the mother is full of antibodies to the vaccine. But the going is that yes, a pregnant mother, a pregnant lady can take the vaccine at any stage. I would prefer personally the third trimester.
And this is something which we have discussed in the earlier lockdown conversations as well. So you may want to have a look at that. But Doctor, one more question, vaccine related, slightly different. Not talking about COVID vaccine, but since a number of children may be due to take some of the other vaccines and we are in lockdown, your general thoughts and what you are seeing, what you are advising your patients with respect to all the different vaccines which may be due. And I know 1 year back, I asked you this question, exactly a year back, and I just want to compare the answer last year and this year.
So last year we had said, yes, the children and parents can wait. There is no point in going out because it's a lockdown or the disease is spreading like anything. But now I would change that. And I would say that the childhood vaccines, not the COVID, the non-COVID vaccines, should all be done on time, because we do not want during a pandemic that we have a non-COVID infection, which is preventable by a vaccine. So my message to all parents is that they should be updated on their child's vaccination and get them done.
No, thank you very much. And clearly the virus is still teaching us new things and we are still learning. One of the vaccine related questions that we discussed, and now it has been asked on the chat, is if somebody is trying to conceive, should she take the vaccine?
The answer is yes. She can take the vaccine and she can conceive the very next moment. Yeah.
All right. I'm going to move on and ask a few very specific questions because I thought, based on my reading, they were very interesting and important for people to know. And this is one regarding G6PD. And Kashish has asked this question, how does COVID affect kids with G6PD? Maybe if you can explain what G6PD is. And I would also ask another question at this point of time, which Dr. Kuku Matthew has asked, is with respect to COVID and asthma. And a number of parents have also asked also about COVID and thalassemia, and COVID and some other, I don't know what sickle cell anemia is. So generally, if you can talk about what sickle cell anemia is, thalassemia, asthma, and G6PD, generally, sir.
So G6PD is one of the enzymes that we have in our body, and some children and adults are deficient in it. And the big thing about being deficient is that if one is having, say, out of 10, he just has a level of 5, then some drugs may cause hemolysis in the individual's system. Like, I'll give you an example. I once, a good few years ago, had a child in the middle of the night, a 7-month-old, with very high fever, and was admitted to the hospital. And the child on the slide test showed that he had falciparum, which is malignant malaria. And we started the treatment for malignant malaria that night itself, intravenous medication. And we sent a blood test for G6PD, which is an enzyme, because we knew that some drugs that are used in malaria are not to be used when an individual is G6PD deficient. Lo and behold, in the morning, when we went to the hospital, we saw that the child is better from the fever point of view, but is looking quite pale, and the hemoglobin came to about 4. And the child's report showed that the child is G6PD deficient. So we had to use that medication because that was the best at that time. But we changed it to something that was less effective, but more tolerable by G6PD deficient individuals. So this is the importance of knowing that somebody is G6PD deficient. Just to let you know, now when babies are born, especially in Calcutta in the Nevatia Hospital, all babies, at least under me, they have a G6PD before they go home. And we pick up quite a few children, boys and girls. It's more common in boys, but it can occur in girls as well, because it is inherited as sex-linked, and they are deficient. So the only thing that they have to be careful about is a list of medication that should not be used if they are G6PD deficient. Otherwise, they do no harm. Coming to the next one of asthma, some people may ask, my child has got asthma and it's related to the respiratory tract, and COVID virus affects the respiratory tract. How do the two take on? Are they kind to each other? Are they not kind to each other? So the answer to it would be, asthma is a common childhood illness. About 8 to 10 children out of 100, at some time or the other in their early childhood, they suffer from it. Some of them grow out of it, outgrow it. So they take medications for it. So if by medications which are preventive, a child is stable with his asthma, and if he were to get COVID infection, the COVID would be no different from any other child getting asthma. However, if the asthma control was poor, then the child may suffer more. So the treatment that the child is getting for asthma in the way of preventive medications or curative medications should continue during the pandemic, and no medications that are regularly taken by a child for one reason or the other should not be discontinued unless medical advice has been taken and has been advised accordingly. The third, you talked about thalassemia and sickle cell. These are disorders that occur in certain communities. So thalassemia is, again, it's a dearrangement of amino acid in the blood. So it can be minor or major. Thalassemia minor has got no issues at all. They live normally. And if they were to get COVID infection, they would not behave differently from normal individuals. Whereas if it was thalassemia major, they would probably suffer a lot. So we need to be very careful to protect. As we said earlier, that there are some comorbid conditions So we talked about heart, lungs, liver, and kidneys. So we should talk about these blood disorders like thalassemia as well. The same with sickle cell. Sickle cell is again an abnormality of the blood where we are deficient in a particular enzyme. And even at high altitudes, we can have a bout of hemolysis. Hemolysis is breakdown of the blood. So we can have a crisis. So in the same way, we do not have much studies yet with COVID, but I'm sure that COVID infection could precipitate a sickle crisis.
So just to sort of summarize a few of the points that you mentioned, if vaccines are due, you should, with suitable precaution and after discussion with your pediatrician, you should go ahead and take it. You've explained the specific issues around G6PD, thalassemia, and asthma. I thought I missed asking this one question, probably linked to lactating mothers and breastfeeding. I want to specifically ask this one, where if the mother, lactating mother, is affected by COVID, then should she breastfeed the baby?
The answer to that is yes. She should wear a mask and follow hand hygiene, sanitize her hands, and she could breastfeed her baby because she would be passing on antibodies, possibly protection to her newborn baby or an older baby.
So again, that's a very important one. Thank you for the person who's asked this question. Must keep in mind, because again, for the young baby, that is probably the only way to build immunity. So definitely keep that in mind. I have a few minutes, and maybe if we can quickly talk a little about SOPs that one should maintain at home, because we are still living in uncertain times. And then possibly, maybe your thoughts on SOPs.
Yeah, so I would say to all parents and grandparents and homemakers, that first thing is that we should not panic, because panic does not bring any success. And children learn the same thing. So we should make them more sort of able to analyze facts and deal with situations as they arise and have plans in place, plan 1, plan 2, and so on. So first is do not panic. And second would be prepared. Talk to your older child. And standing operating procedures, as Ravindra always talks about, SOP, should be written out, I would say, for a family. Have online consultation request with your pediatrician. And if your child is unwell, I think you can request your pediatrician to have your number saved. And red flag signs, again, I would reiterate here, and they would be rapid breathing, a falling SpO2 on the oxygen monitor, persistent fever, lethargy, drowsiness, poor feeding or not feeding. And I would say the last thing, very important, understand your instincts and your child's instincts. They are very important.
Well, thank you very much. We've taken up a lot of your time, and we kept this for an hour. We are getting to the hour. There have been more than 400 attendees at one point of time listening in. We've never had these many people. Of course, this is of great significance to our families. Earlier, we didn't think that children were impacted. We knew they were carriers, but clearly they are getting infected, and we need to be mindful and be prepared. We've discussed about immunity building, what to do, the treatment, post-COVID. Must remember about MISC. So, Doctor, if I may, and I've taken the liberty of passing your details and posting your details on the chat in case anybody wants to reach out for an online consultation. Please feel free to do that. We can't take up every question, but in terms of takeaways, the 4 or 5 key takeaways, if we were to summarize, what would they be?
Okay, I'll say that again. So first of all, for parents not to panic, yeah, and children as well, and to prepare your child, and he should be aware that there's a pandemic going on. You know, this is once in lifetime. The last pandemic was over 100 years ago. So maybe the child who is just a teenager or 10 or 12 years old may never see it again. So he should have an experience, a first-hand experience of it. And online consultations, as I said. And the most important, again, I reiterate, majority of children will have a mild illness, more than 85%, about 85%. And in the others, the red flag signs, we should be very aware. We should write them. I think as parents, we could discuss them. Fast breathing, yeah, and fast heart rate, the rashes on the eyes and on the mouth and on the hands. They are very important. Poor feeding, diarrhea, vomiting, pain in the tummy, and a persistent fever.
And of course, have your SOPs in place. Make sure that in all the details, the child details, your doctor details, who to contact in the case of need, who will be the primary caretaker. It can't always be all the parents. It has to be, the right one. And maybe one thought on the primary caretaker. We've discussed this for our household with you.
Yes.
So maybe your thought, and perhaps maybe if we can take the liberty to share the SOPs which we've prepared for whoever wants.
So what we have done is, in our SOP, we have said who are the family members who should be aware, and who are the doctors, the physicians where we should reach out to, and the possible hospital where, if it is required, whom to contact, who are the contact people, who are the intensivists there, who are the internal medicine people there, and who are the pulmonologists there. Because generally the care, if it's an intensive care setup for an adult or a child, it's an intensivist, a pulmonologist, and a general medicine, internal medicine person.
Well, if anyone wants to have a look at the SOP we've put in place at our household, and courtesy Dr. Agrawal, please feel free to reach out. I will try and put it out. I'll figure out a way to put it out so all of you can see it. But definitely be mindful. Thank you, Dr. Agrawal. We are coming to the end of this one. Apologies, those of you who are still there, if your question couldn't be answered. There were far too many questions. I had more than 250 questions which came in. We tried to bucket it and ask as many we could to our speaker. Yes, the recording is going to be shared. It will give me a day and a half. Please do create awareness. Please do share information responsibly. We are living in uncertain times, and we owe that to everyone. I would say a big thank you to you, Dr. Santosh Agrawal, for taking the time out and doing this, and to everybody else. More than 300 people still there. Stay safe, stay well, till we meet again.
Thank you very much, Rabindra, and thank you for all the attendees this afternoon. I hope it's been useful, and we'll look forward to seeing you again. Wish you all the best for your families. Thank you.
Thank you so much. We'll just mute everyone now. We'll mute both of us, and we'll stop the recording in a minute.